Hey class, welcome to week 4. Please pardon my voice, I've got a little bit of a cold going on this week. Week 4, you will have your first test on chapter 51. Also, you'll have your regular assignment on Connect2. The test will also be on Connect. And last but not least, there's a smart book assignment that you can use to prepare for the test and also to get extra credit. That extra credit, I will detail out in the course announcement how much extra credit it will be and where it will be applied to. And if you have any questions, always please feel free to email me. So we're covering the last part of chapter 51 today, 1137 through 1141 in the book. And we're starting off talking about prescriptions and the different parts of a prescription. Any drug that is not over-the-counter or OTC requires a prescription. As a medical assistant, you need to be able to interpret that prescription in order to discuss it with the patient, prescriber, or pharmacist. So interpreting a prescription. Prescription for new or refilled medications are completed and approved by a licensed practitioner. It has specific parts that must be present before the patient can have it filled. The first part is the prescriber information. This usually includes the name, address, telephone number, and other information of the prescriber. Next up, you have the patient information. That'll be the full name, date of birth, address, and any other information that might identify the patient. You'll have the medication prescribed. This could be the generic or trade name, brand name, strength and quantity. And this is sometimes called the inscription, and it is found after the RX on the actual prescription. You'll have the subscription, which is the instructions to the pharmacist dispensing the medication. This may include generic substitution and refill authorization. You'll have the signa, also known as transcription, refers to the instructions for the patient. These usually follow the instructions usually follow the abbreviation SIG, which means mark. The prescriber's signature has to be written on the prescription in ink. It cannot be a stamped signature. A digital signature is used if it is secure and you're using computerized physician order entry. Otherwise, it does have to be signed by the prescriber. Also includes the date the prescriber wrote their signature. The DEA number may also be on there. This is required for Schedule 2, 3, 4, or 5 medications. Many terms and abbreviations are used in the prescriptions. We'll reference Table 51.5 for those terms, and you don't have to memorize all of them. I would just become familiar with them and know where to look for the answer if you need to know what they are. Managing prescriptions. Prescriptions may be printed or handwritten on a prescription blank or entered electronically and submitted electronically to a pharmacy. When they're electronic, that is known as e-prescribing. With e-prescribing, the medication information is received at the pharmacy. The actual prescription is never in the patient's hands. This is considered a very secure and safe way to transmit prescriptions and less likely to run into things like diversion or patients writing their own prescriptions, etc. Telephone prescriptions. If requested by the licensed practitioner, you might end up telephoning a new or renewal prescription into a patient's pharmacy. Likely, as a medical assistant, you will not ever do controlled substances or especially Schedule 2s depending on what state you're in. In an emergency situation, when a patient needs a drug immediately and no alternative is available, a prescriber can telephone in a prescription for a Schedule 2 drug and must be limited to the period of the emergency, and the actual prescription must be mailed to the pharmacy within 72 hours. The pharmacist has to notify the DEA if that does not occur. Non-pharmacologic pain management has a lot of different options, and these are not always things that are covered by insurance. However, they are very effective and can be helpful to a patient to avoid taking medications. Taking medications can often involve adverse reactions, drug interactions, dependence, or cost. So sometimes patients prefer to avoid those. Our first option would be chiropractors. Those are used to adjust the spinal column and to treat chronic neck or back pain. Massage therapy can be used to treat muscle pains, headaches, arthritis, and promote healing through relaxation. Acupuncture is a procedure in which very small amounts of electrical current are applied through needles and is used for pain management. Yoga uses postures to exercise the spine and stimulate the lymphatic system, helping the body to remove toxins that might cause pain or stiff muscles and joints. Meditation can be used to balance a person's emotional, physical, and mental state and treat stress, anxiety, and pain. Hypnotism might be used to help patients overcome pain as well. Glucosamine chondroitin is a dietary supplement used to treat osteoarthritis, and it's supposed to slow down joint cartilage damage. We'll often see this used in larger dogs as well. Magnetic therapy involves the use of magnets of varying sizes and strengths placed on the body to relieve pain or treat disease. And last but not least, biofeedback can help a patient learn to evoke relaxation, which can help block pain perception. So let's talk about vaccines, and then this chapter is all set. A vaccine is a preparation made from microorganisms and administered to a person to produce reduced sensitivity to or increased immunity to an infectious disease. You are probably familiar with childhood vaccinations such as measles, mumps, rubella, influenza on a yearly basis, tetanus, etc. There is a schedule that you can access on the CDC's website. I'll try to include that in week 4 links. And the way that vaccines work is they help your immune system to identify antigens and form antibodies. Antigens are foreign substances such as bacteria, viruses, and other organisms that can enter the human body in spite of its natural defenses. In response to an invasion by antigens, the body's specialized white blood cells called lymphocytes produce antibodies. These are specific to the invading antigen and combine with the antigen to neutralize them. This means that the antigen can no longer cause disease or replicate, possibly. Vaccines contain organisms that have been killed or attenuated, which means weakened. And because these organisms do not overpower the body and cause disease, they instead stimulate antibody formation. The body recognizes them as foreign and forms antibodies. That way, the next time it comes into contact with that antigen, it can stop it in its tracks before it causes a problem. You may still see, let's take influenza for example. You've heard of people getting an influenza vaccination but still getting the flu. However, the hope is because they have the vaccine, the resulting influenza that they have afterwards might be less or not as severe as it would have been without the vaccine. So, the Advisory Committee on Immunization Practices, the American Academy of Pediatrics, and the American Academy of Family Physicians jointly publish immunization schedules. These schedules cover children from infancy through 18 years of age, and you can also see schedules for adults. Sometimes people may need vaccines if they have their spleen removed, and as we've seen within the past few years, they'll develop vaccines in the midst of a pandemic. You can see the schedule in figure 5110, and those are adult immunizations. Again, the pediatric one is going to look a little busier. There's a lot more immunizations that occur, and I'll try to share the links to those in week 4. That is the end of this week's lecture. I'm very sorry about my voice. We will be moving on to chapter 52 next week. I'm also going to post on a student suggestion. I'm going to post a little bit about addiction and addiction medicine and what role it plays in our society today. Addiction often is seen as a terrible disease, which it is, but it truly is a disease, and oftentimes people fall powerless to its effects. They don't necessarily choose to be addicted. The chemicals that they're addicted to create very powerful desires and cravings and needs for those drugs. And oftentimes, even if people seek out help and they want to get better and they know they could have a better, happier life without the medication, it's very hard to break the cycle. So, our goal in this class is to help sort of open your eyes to that and get you some information so that if you ever come across a patient, you can encourage and support them and hopefully not place judgment. The idea is that if there's enough encouragement and support, hopefully we'll be able to get people the help they need and get them on a path back to recovery. I hope you all have a great week. Please email me with any questions.